The health department insists that bad weather won't be a reason to stop vaccinations amid the ongoing pandemic. That's despite only logging 136,000 vaccinees on Sunday, which is relatively lower compared to the daily average 200,000 vaccinees. To give us more updates, we have Jen Calimon now joining us live from Malabon. Good afternoon, Jen. Could you give us the reasons for having just this number of vaccinees yesterday?
Yes, Charles, you're right. So this weekend, we have only reached 136,000 vaccines administered, which is far from our 200,000 plus average daily capacity. Yusek Vergere said that some vaccination sites have temporarily shut down or closed due to bad weather. Aside from this, she also said that usually turnouts are low during weekend because vaccination sites are closed to give our healthcare workers a time to rest. Charles?
Right, Jen, do we have any updates on the Delta variant of the coronavirus so far? Is it now the dominant variant of concern in the country?
Yes, Charles, the DOH and the UPNIH over the weekend detected 55 new Delta variant cases. Of these numbers, 37 are local cases, 17 are from returning overseas Filipinos, and 1 case is currently being verified if this is a local or ROF case. So of the 37 local cases, 14 were from Calabarzon, 8 from Northern Mindanao, 6 had an indicated address in the NCR, 6 from Central Luzon, 2 from Davao region, and 1 from Ilocos region. So 1 case has died, while 54 cases have been tagged as recovered. So this brings the total Delta variant cases to 119. Charles, the Beta variant remains to be the most dominant among all the variants with 21.64%, while the Delta variant is only at 1.27%.
Right, Jen, of those who were found to have the Delta variant of the coronavirus, do we know what their vaccination status were? And do we now consider there to be a surge because of the Delta variant?
Yes, Charles, the DOH is still completing their data on this, but initially they reported that in 4 cases in a particular area, 2 have received their full dose of vaccine, 3 had mild cases, and 1 is asymptomatic. In another area with Delta variant cases, 5 have received their first dose, 3 have mild symptoms, 1 is asymptomatic, while the other 1 is still being verified. Also, Charles, the DOH said that we should be careful in using the word surge because it has a different terminology in the Epidemiology Bureau, and it might cause more fear to some. But yes, Charles, they have confirmed that there is indeed an increase in cases in many areas in the country.
Right, Jen, I understand that the DOH is no longer observing the reproduction rate of cases when looking at the COVID-19 situation, at least in various areas. What do they use instead, and what was the logic behind this?
You're right, Charles. Determining the reproduction rate in an area is still important to see the overall situation of COVID-19 cases in the country. But they do not very much observing this because, as Vergere says, it is a lagging indicator. So there is a time gap wherein they only see the onset of symptoms that happened 2 weeks ago. So what they use in observing the trend in cases are the daily attack rate and the 2-week growth rate. Charles?
Thank you for those updates, Jen. That was Jen Calimon reporting live from Malabon.